I'm Doctor. I'm going to discuss about anesthetic pharmacology regarding succinylcholine part 1. So, regarding the pharmacology, succinylcholine is the only depolarizing muscle relaxant in clinical use. So, it's chemically related to acetylcholine. Two molecules of acetylcholine combine to form succinylcholine. It stimulates the cholinergic receptors, that is M receptors, the neuromuscular junction. So muscarinic receptors are also activated, which results in side effects of the succinylcholine. Pharmacokinetics and pharmacodynamics given in intravenous or intramuscular route. So if intravenous access is not available, we can give it in pectoral muscles or deltoid muscles for faster onset of action when compared to the thigh muscles or gluteal region. So we can give intramuscularly. The dose only varies. It has a half-life of 47 seconds. So the dose to reduce the twitch to 95% is zero point 0.3 milligram per kg. Intubating dose is 1 milligram per kg in adults. So it varies according to the age of the patient. In infants, the dose increases up to 3 milligram per kg because of the increased volume of distribution. So it undergoes rapid hydrolysis by butyrylcholinesterase, otherwise known as pseudocholinesterase. Recovery is very rapid. Factors affecting butyrylcholinesterase, that is pseudocholinesterase, or advanced liver disease, advanced age, pregnancy, post-burns, drugs such as anticholinesterase, metoclopramide, cytotoxic agents, neostigmine, that is anticholinesterase, decreases the butyrylcholinesterase activity. Coming to adverse effects, cardiovascular usually results due to second dose of the succinylcholine. So usually we are giving half the dose in the second dose of succinylcholine. So it causes sinus bradycardia, junctional rhythm, sinus arrest. So these are the some of the cardiovascular adverse effects of succinylcholine. It may also cause sinus tachycardia, tachyarrhythmias. So atropine is effective. So we are giving atropine before giving the second dose of succinylcholine to prevent cardiac arrest or sinus bradycardia. Adverse effects continuation, hyperkalemia is one of the most important adverse effects. Increase in potassium by 0.5 milliequivalents per liter in normal patients. So in renal failure patients, they are more susceptible to hyperkalemia. There will be more increase. In post-burns, neuromuscular disorders, muscular dystrophies, in hemiplegia, paraplegia, there will be proliferation of extrajunctional receptors. So when succinylcholine is given to these patients, it may activate the extrajunctional receptors, which will open the potassium channel for more prolonged period. So it results in significant hyperkalemia. So we should be very cautious while using succinylcholine in these patients. So coming to the next adverse effect is increased intraocular pressure. So when given succinylcholine, the intraocular pressure peaks at 2 to 4 months, returns to normal by 6 months. So we are avoiding the succinylcholine in open eye injury. Then next adverse effect is the increase in intragastric pressure due to fasciculations of abdominal muscles, direct increase in vagal tone. So avoiding patients with hydatid cyst. So the fasciculations in abdominal muscles and increase in vagal tone may cause rupture of the hydatid cyst and cause severe anaphylactic reactions. So better to avoid succinylcholine in patients with hydatid cyst. Uh, in literature says there is decreased, no significant increase. So in incidence of regurgitation, we can use in emergency intubation. So other adverse effects include increased intracranial pressure, myalgias, masseter, spasm, and the most important thing is phase 2 block. So much. We can see about the uses and phase 2 block in the next presentation. Thank you.